there, thanks for joining us on State of Texas. I'm Wes Rappaport in for Josh Hinkle. The days between Christmas and New Year's usually bring people together with friends and family. For many Texans, this year's different. This week we're looking closer at the mental health impact of the pandemic and efforts to help people cope. We'll look closer at ideas to identify people who need help and help young Texans deal with the pressures of learning. And we'll speak with two state lawmakers, a House veteran and a newcomer to the Senate, about policy plans to improve mental health services. But we start with a personal story. I had the chance to speak with a Texan diagnosed with depression about how to cope during these difficult times.
The first time I ever experienced depression was when I was in the 5th grade.
Dana Baer has dealt with depression most of her life. She tried meds, but they didn't help long term. A non-invasive treatment at Texas Tech University Health Sciences Center called transcranial magnetic stimulation helps Baer manage her symptoms. But the holidays bring a heightened sense of loneliness because she can't be with her family due to coronavirus concerns.
Very solitary.
Very solitary.
It's okay to not be okay. It's okay to be sad and disappointed.
Baylor Scott and White psychiatrist Joanne Sotelo says long-term loneliness can have lasting effects on the brain.
To the point of it affecting our long-term risks as the way smoking or obesity can, right? It increases our chances of having heart disease and dementia on top of the depression and the anxiety.
Dr. Sotelo says it's critical for people to reach out to a friend or better yet your doctor if you're feeling down.
We cannot ignore it. We cannot minimize it. We cannot I'll just toughen up and push through.
Baer also battles seasonal affective disorder and tells me looking for that silver lining helps her get through the winter.
We have that first pretty day and it's like, oh boy, spring really is coming. And, it kind of gives me a little hope and energy that, okay, yeah, everything's going to be all right.
Looking for that spring day, particularly early this year, huh?
Yes.
Dr. Sotelo says talking about mental health is an important first step to get help. So we're going to do that. Joining us now is Dr. Sarah Wakefield, chair of the Psychiatry Department at the Texas Tech University Health Sciences Center School of Medicine. Dr. Wakefield, thanks for your time. Let's jump right in. Is there anything psychologically that happens when we spend too much time alone?
Well, I think we have to remember humans are social creatures and we're built for interaction. We know there are people who are more introverted and like to have time spent alone, but that's really a break for them from being around large groups of people. But we all need human interaction. And really our brains are more stimulated by doing that. Our cognition is better. And there is a concern that the more isolated you are, if you're not doing other things to stimulate your brain, that you can have some decrease in your cognitive function and also in your emotions. And so in the time that if you're not socializing and getting out and doing those daily things that we all have been used to before this year, trying to find a way to do that is really important, whether that's taking a walk or calling somebody via Zoom or some other platform so that you can interact, really important.
We heard from the patient about spending the holidays alone. What advice do you have for people who will be without their loved ones during this time to try and cope with some of the symptoms that come with that?
Yeah, I think it's really important to remember that being physically alone doesn't have to be being emotionally alone and being socially alone. And so trying to find those ways to connect, even when you're not in each other's physical presence. So that can be a phone call. It could be, my kiddos actually did some crafts and we've sent them to the grandparents. So to have that connection where you're thinking about the other person, doing something for them, sending it to them, or taking a picture and sending it to them, really is the thought that counts in this situation, that we are finding ways to feel connected and to be connected in this time, even when we're physically distanced.
Dr. Sarah Wakefield, chair of the Psychiatry Department at the Texas Tech University Health Sciences Center School of Medicine. We appreciate your time. Thank you so much.
Thanks so much for having me.
New research at Texas State University indicates there could be a growing problem called compassion fatigue. The researcher says that as professors care for or help others during the pandemic, it can leave them feeling psychologically overwhelmed or emotionally numb. Tahera Rahman reports the university's counseling center hopes an avatar-based simulation can help.
Sometimes I get tired of dealing with the drama too.
A program at Texas State University is using artificial intelligence to identify, talk to, and refer people dealing with mental health problems.
You take on the role of either a faculty member or a student, depending on the simulation, and you talk to a student that is programmed with emotions and memory and personality, and will react like a real student in psychological distress.
More than 4,000 Texas State students have gone through Cognito since 2013. Co-founder Glenn Albright says the program's new version now tackles a new stressor, the coronavirus pandemic.
You're addressing how students can identify a fellow student in social media who's in distress. As a result of the pandemic, you have the self-care, self-empowerment strategy.
A virtual coach walks you through conversation tactics.
We're not going to always be the first office that they reach out to.
Richard Martinez with the university's counseling center says many students are reaching out to their professors for help, which is why they're encouraging more staff to utilize Cognito too.
We're not only trying to take care of ourselves and keep ourselves safe and having our own reactions to the pandemic, we're also trying to take care and support our students who are going through that as well.
Tahera Rahman for State of Texas.
Any person affiliated with Texas State University can access the Cognito Mental Health Training Program. Sul Ross State University, Texas A&M, and UT Southwestern Medical Center also use the program. The pandemic response included waivers to give patients more access to telehealth services. But will that continue once the virus subsides? We'll put that question to a key state lawmaker. And later, work begins on an ambitious plan to improve mental health care in Texas. Why the plan still needs action at the Capitol to reach the finish line.